One of the main reasons that people regret their Medicare decision is because they begin in the wrong place, which one, leads them down the wrong path, but two, also takes a lot more time to make your Medicare decision. So in this video, I want to be really clear as to where you should begin your Medicare process, your Medicare research, so that you make your right Medicare decision to protect your healthcare rights and retirement savings. I'm Emily with the Medicare Coach. We're an independent, fee-based Medicare consultant helping our clients easily navigate both the Medicare rules, but also insurance company options to do what's right for you to have the best healthcare while again protecting your retirement savings. And if you want more shortcuts to Medicare, in the resource section below, I have some links to things to make Medicare so much easier for you. So let's jump into this video as to where should you begin your Medicare process. Most people start with Medicare by seeing commercials or getting a pamphlet in the mail or hearing a friend talk about Medicare. But that's a big mistake for many reasons. One, because you're not really sure what those plans are, and if they work for someone else, it's not guaranteed to work for you. So the number one place that you should all begin when it comes to Medicare is asking your doctor, what type of Medicare does your doctor accept? Most of us want to keep seeing our doctor once on Medicare. And therefore, it's important to have a health insurance plan, a Medicare plan that will actually be accepted by your preferred doctor. So go to your doctor and ask them this one simple question. Do you take original Medicare or Medicare Advantage? And then write down what they say. And if they say, yes, we take Medicare Advantage, ask them, well, which specific Advantage plans do you accept? Most areas have between 20 and 50 Advantage plans to pick from, and you want to be clear, does your doctor or healthcare facility take that specific Medicare Advantage plan? So this is the best place to start because one, you know what your doctor accepts, and two, if you want to keep seeing your doctor, they're not going to take all the plans. And by having the answer to this question, you can usually eliminate about 3/4 of your plan options out there, okay? We're at least getting really clear as to which path to go down. We can ignore those commercials, those pamphlets, all of those things, and really have an idea of what Medicare path fits you the best. Now, yes, there are additional steps from there around medications, coordinating doctors, things like that, but begin by talking to your doctor. Now, you might say, but Emily, I don't have any doctors, right? I don't see anyone, like what should I do? And my recommendation to you is ask yourself, if you were to have health issues, who would you want to see? Because of Medicare's guarantee issuance rules, it's really hard to make certain changes once you're on Medicare. And for that reason, I highly recommend that you think about the long-term implications of your Medicare decision, right? So if you're healthy now, but if you might have, I don't know, I feel like everyone has cancer these days or has a hip replacement or a knee replacement or something of that nature, who would you want to see? And maybe you don't care, and if you don't care, then that's fine. But if you do have an opinion about the doctor that you would want to see if something were to happen to you, I think it's worthwhile to ask yourself, who do you want to get care from? And what type of Medicare do they accept? Because again, that will help you narrow down your options and get on the right path when it comes to Medicare. So hopefully this helps to help you understand where to start. Talk to your doctor, talk to your providers to get some clear answers from them. And it will help easily make your Medicare decision that will fit for you. So again, if you like this video, give me a thumbs up. Otherwise, let me know your comments below, and look forward to helping you easily make your right Medicare decision.